Our conversation with Miss Lisa Spencer from the Indiana County Department of Human Services is brought to you by Marcus & Mack, a law firm representing injured people. She's with us on the line right now. Lisa, good morning.
Good morning. How are you?
I'm wonderful. It's good to have you with us again here today.
Yes, it went so fast, and I missed you last month, just so you know.
Tell me, you're telling me it snuck up on you again, did it?
It did. This summer is flying by.
Yeah.
It is going so quickly that I'm not sure if other people feel that, but I can't believe that we're already in August.
Mm-hmm. It's a pretty amazing thing. Well, hey, let's get into a little conversation today, specifically about contact tracing. And Indiana County actually does have a movement going on that is going to help people to do their part in maybe eliminating or at least limiting the scope of coronavirus infestations or infections. And so let's talk about that here this morning. Indiana County, part of the Southwest region, and there are actually some jobs available in this field of contact tracing. Let's first explain what contact tracing is.
Right. So, Leah, let me give you a little background here. Robert Ferguson is the Chief Policy Officer for the Jewish Healthcare Foundation, and this is in Pittsburgh. And so for the entire Southwest region, they are coordinating contact tracing. And the idea behind this is when somebody ends up with a positive test for COVID-19 through the Department of Health, it's supposed to go back to these contact tracers who will then call the person and try to get more information about all the different people that they've come across or have been involved in or been in close proximity to, so that they can contact those people to say, hey, be careful, you might have been exposed to COVID-19. And if you develop symptoms, you will need to talk to your doctor to get advice on, what the next steps are. So that's the whole idea, because they're trying to figure out how to contain COVID-19, the spread. And the really tricky part of this seems to be the asymptomatic people.
Yeah.
So I think that's just something that we can't get our hands on, because if you don't know that you're carrying, the virus because you're not symptomatic, but you're still out and about everywhere, that makes it really difficult to try to contain the virus.
Yeah. So how does Indiana County play a role in this?
Okay, so the Pennsylvania Department of Health has just put aside $23 million to fund this initiative. So they hired a company called Insight Global, and across Pennsylvania they're going to hire 1,000 paid contact tracers. So they were actually initially for the Southwest region, including Indiana, they were looking for 60 full-time or 120 part-time contact tracers, but they were trying to get that many in volunteers, but they're just not getting the volunteers to do this. I think at the time that I last checked, they had maybe 16 approved and maybe 6 that were pending, or 6 approved and 16 that were pending. So they're not getting the volunteers to do this. So they've decided to put aside this money, and they're going to be hiring case investigators, community health nurses, and hiring field managers, and then the actual contact tracers. So right now what's happening is, for our local Department of Health, our community health nurse has been pulled over to Westmoreland County to assist on this contact tracing. So what they're trying to do is get the community health nurses back to their community and, beef up the contact tracing so that they can take that off of the community health nurses, so they can make sure that they're helping in different capacities.
Like a lot of the various efforts that have been made here in COVID-19, it seems like it's an evolving thing, isn't it?
Yes, I think it's just, I think sometimes we're just learning on the curve here. I think there are a lot of things that are occurring that we just couldn't have known. So I think the learning curve's rather high, and we just keep changing and trying to evolve as we're coming around to make sure that we are trying to stay on top of this the best we can. But as well as I do, it's so difficult to get the messaging out sometimes, just to be like that, clear, concise message that, everybody just wear a mask, wash your hands, social distance, I mean, by now we almost sound like broken records, but I can still go into stores and I can still see people not wearing masks, and I can, see people getting crowds close together without masking. And if we just do little things, it'll make a bigger impact so we can minimize, how much of this we keep spreading around to everybody.
Yeah. So for folks who might be interested in becoming a part of this movement, is there a central place that they can go to, a website, phone number?
Yes, it's actually, the link is actually rather long, so I thought I'd give it to you. I'll tell you what it is here, but then maybe we could post it on your site.
Yeah.
It's actually www.health.pa.gov/disease/coronavirus//pages//tracing.aspx.
I got it.
So that's a whole lot of wording.
Yeah.
Just go get information about contact tracing. But I'm sure if you just get on the health.pa.gov website, I'm sure there'll be something that will be a quick button to a link that will take you into contact tracing, because this seems to be a huge push right now to see if this virus can get some sort of containment on it at this time.
Yeah. If you go to health.pa.gov, the immediate topic that comes up is popular on health.pa.gov, and in the second column there's a link there for that site that you just gave us for contact tracing. So it's very, very easy, just health.pa.gov. But we are going to turn this into a news story and probably run it tomorrow with your voice to help people understand a little bit more and maybe keep the story alive for a day or so, because it's a very important thing as we continue to try to do whatever we can to stop the spread of the coronavirus. So that's good news that folks are out there, and that they can actually, if it takes the financial incentive to do it, or if it just takes the more publicity to do it, it's something that needs done.
Right, and this Insight Global company is actually, they'll be contracting these workers. So that's the best way to do it, is to hop on there, do whatever you need to do with fill in the application or whatever they have you do, and go through it that way. The good thing is this is almost a job that you can do at home, because you can do it by phone. And so that will help some people. And if some people couldn't get back into work, this might be something that they can look at, just to try to get some income flowing again for their families.
Yeah.
So,
Good
this has been, I think, like you said, it's kind of like every day we learn a little bit more about how we can kind of combat what we're doing. But it's going to take all of our efforts to try to really, all of us work together so that we can get, lower our numbers enough. So I know there are a lot of people have concerns about many things, kids going back to school, or IEP coming back, or, whether events should be held or not, or, should stores be open. I mean, we have to find a way to make all of this work, though, because eventually we're going to have to get some semblance of normalcy, but I'm not even sure I'd even say we'd go back to normal. But we have to figure it out as we go. And if these contact tracers do cause some of the barriers that they're running into when they're calling people, people just do not want to give out the information, and they're hanging up on them. So there's no way that we can find out, not me personally, but the contact tracers wouldn't be able to find out who they might have been around, so they could give heads up. And so I do understand that to an extent, because for all you just never know anymore. Like when somebody calls you, you just never know. But they should never, never, never ask for any personal information, no social security numbers, no financial information. Nobody should be giving out any of that information over the phone to anybody. But specifically for contact tracers, this has nothing to do with getting anybody's personal information or financial information.
And
this
plus,
is strictly related to COVID-19.
for somebody who has received the positive test result that says, yes, you have or have had coronavirus, that should be your first hint that somebody is going to follow up with you. And so you should pay attention to whatever that call is. But don't give out anything personal that is going to allow someone to defraud you of anything. Lisa Spencer,
Yeah.
Department of Human Services, thank you so much for being with us today. We appreciate it.
All right. Have a great day, Todd.
You too. We'll see you.
Okay. Take care. Bye-bye.
There is Lisa Spencer from the Indiana County Department of Human Services. Of course, all of our conversations brought to you by Marcus and Mack, a law firm representing injured people.